So welcome back to the next part of your virtual taste today. It's good to see everyone logging back on, and I hope you are enjoying the day so far. So for this session, for the next 45 minutes, we are joined by Adam, who's going to be looking at health tech, so looking at x-rays and how they are used. So it's going to be a fun interactive session. And just to explain, guys, so in order for you to ask questions or communicate throughout this session, you will see there is a chat box like with the previous session, but there is also a Q&A box as well. So please do direct any of your questions that you might have for Adam into the Q&A box. But I'm now going to hand you over to Adam. Hi there, Adam.
Oh, hello guys. Am I muted? Is my first question. I've got so many things.
No, we can hear you. That's all great.
Excellent. Okay, guys. Sorry. Hello. How are we? How's your day going so far? And if you want to put that in a chat bar so I know it's working, that'd be really good. So if you want to say you're having a great day, just put yes, amazing. And if not, then no. Excellent. Thank you, Evelina. Right. Okay, guys. Oh, hello. Look at this. I love it when it goes mental on the chat bar. Okay, guys, rather than use a Q&A box, because that's too many boxes for my screen, if we just use a chat bar, that'll make my life so much easier because I'm just a simple man. But you can all see my screen. So I'm Adam from Health Tech, and we are actually part of the NHS. We are the careers hub for the NHS within Thames Valley. And what we do is talk about careers within the NHS across all 365 different roles. But what I'm going to try and do now is make sure my screen is working. And there we go. So first question, guys, drop it into the chat bar. What is the NHS? Just throw it in there for me. Oh, I've got a halo as well. Look at that. Oh. National Health Service, yeah. National Health Service, National Health Service. Well, it's reassuring everyone's getting the correct answer, which is really good. That's always good because you sometimes get some really weird stuff coming on. But what does it actually stand for? As in, we know it stands for National Health Service, but what does that mean? What does it mean, guys? So Sandra's kind of got it, that it's a healthcare provider. But it's free healthcare. Okay, Emily, great. It's free healthcare and it's a publicly funded institution. Well done. Is that Messina? Well done. Okay, yes. So I'm not sure how old you guys are, but whenever you turn 16, you get a national insurance contributions you have to start paying out of your taxes, and that funds the NHS. Okay, so the NHS is, we say free healthcare, and we're going to go into that into a minute, but it is our healthcare service for Great Britain and Northern Ireland. That does not include the Channel Islands. So if you ever go to Channel Islands, you need separate medical cover. And it does not include the Isle of Man because they have opted out of it as well. So it's Great Britain and Northern Ireland. Okay. Right, do type the panels. Yeah, okay, right. So we kind of got this one already, and I'm sure Emily said this, but what's unique about the NHS? Yes, okay, so Roses is kind of copying on Emily. It's free, it's a free health service, free healthcare. Okay, now this is a big thing that people say it is free, but the NHS, most importantly, is free at the point of need. Okay, so say for example, right now, I was to go and break my, actually, let's just say someone's walking past my house, and I don't like the way they look, I go outside and break their leg, just because I'm horrible like that. If I were to do that, they go to hospital here. Is that to me?
Oh, no, so I'm just replying. So just to confirm that a few people have been asking, so we can't see or hear you, students, so don't worry.
Oh, right, sorry. Okay, I was like, oh, panic. Right, so say I went outside and broke someone's leg, so I'm a really horrible person. Okay, now they would go to my local hospital, which is Stoke Mandeville, and the first thing they would do is actually treat the leg, okay, and get it fixed. So X-ray, do all that sort of stuff, and make sure you're okay and you're sorted there. Now, how much do you think it costs to repair a broken leg on average? Just throw it in a chat bar. How much you reckon? £350, 1,200, 5,000, 250. Okay, 300. The average cost of repairing a broken leg is £4,500. Okay, guys. So That's actually quite a lot of money, and I don't think many of us carry it around in our back pockets. So in the UK, you wouldn't have to pay for that. You'd get treated first, and then money would be sorted out later. If I was in somewhere where you had to pay for your medical services, like America, and I guess some of you probably pre-pandemic have been over to the States, that if I was to break my leg over there, the first question I would be asked is, how am I going to pay? Do you have insurance? If I haven't got it, what are they going to do? That's the question there. What are they going to do if I haven't got the money? Not true. Well done, Roses. Okay, refuse trip. Yeah, I would get moved on to the next hospital and the next one until someone would treat me for free, or I can somehow find the money. That doesn't work in the UK because the NHS is free at the point of need. All right, guys, that's a real crucial thing that's going on here. Don't. Sorry, my cat is now suddenly got interested because the video's on. Don't. Okay. Who's allowed to use the NHS? Okay, everyone. Okay, oh, everyone. Oh, you absolute, excuse me.
So yeah, people put everyone, nurses, doctors, anyone who is in the UK, residents of the UK, everyone.
Okay, so believe it or not, the NHS is free at the point of need for everyone. Okay, and that is fine. So if you were a foreign national and you came here, you will be able to use the NHS. Just because, and you hear a lot of this thing about healthcare tourism, okay, that is a thing, people do come across it, but they do actually pay. So if someone is treated and they're not a UK taxpayer, the NHS bills that country's government for their treatment. Okay, so everyone does pay eventually. We don't pay because it's taken out of our taxes, and that's our national insurance, Emily, taxes that go towards the NHS. Okay, so we don't pay. We've always been paying for it since we're 16, and people who come abroad and use it, they will get paid via their government or by their travel insurance. Okay, so anyone is allowed to use the NHS. Okay, right. Now, what establishments make up the NHS? So what are the constituent parts of it?
What do you think, guys? Do pop it in the chat box.
I'm thinking more about buildings, not people. So hospitals, yes. Hospital trusts, yep. GP surgeries, dentists, yep. GPs, hospitals, hospices, yes. Care homes, yes. Nursing homes, yes. Care homes. Ambulance service, well done. Yes, they make up the NHS. What about these things? Optician, well done. Pharmacies, yes. Orthodontics, yes. Mental health trusts. Inpatient, yes. Physio services, clinics, all these different places all make up the NHS. Okay. Now, A&E is usually part of a hospital, but sometimes do have separate departments. Just out of interest, guys, how much do you reckon it costs for a relatively simple pregnancy? Okay, so all you guys have already cost the NHS money just by being born. And on average, for a relatively simple pregnancy, how much do you think it costs? Drop it in a chat bar, and I'm just going to move my cat out of the way.
So let's have a look at what you guys have put. So £1,000, £200, 15,000, 10,000, 7,500, 10,000, 6,000, 5,000, 15,000, £250, 7,500, 2,000. So
Elizabeth's the closest so far, and Leah. Martha's getting closer. Okay, guys, so on average, with a typical birth, with all the appointments, all the ultrasounds, all the treatments, costs £45,000 to give birth. Okay, guys, that's quite a lot of money. Now, obviously, we don't pay that for every child we have because that would be an awful lot of money. We couldn't afford it. It's paid for our taxation, which is a kind of an economy of scale, which you guys probably know about in business and stuff. Okay, so it's a lot more money than you would think, and it's an economy of scale. Right. So I'm going to give you guys 1 minute And what I want you to do in a chat bar, drop as many different careers that you can think of, and I'll tell you when to start. Don't start yet. As many different careers that you can think of in the NHS. And what you're going to do is the record for this is 41 different careers. Okay, but I'm going to give you a minute. I've just opened my calculator. I'm going to give you a minute to try and find as many as you can. Okay, and drop them in the chat box. Get your fingers poised. Get ready to hit the enter key. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9. Oh God, 10, 11, 13, 14. Midwife CS 15, 16, 17. Oh, 18, 19. Yes, 20, 21. 22, 23, HP, 24, dietitian 25, 26, 27, consultant, that could be a lot of things, 28, 29, music, radiologist, dietitian, 29, dermatologist, well done, music therapist, heart therapist, 30, saw something 31, hematologist, 32, 33, dance therapist, LHP, oncologist, 34. Okay, guys, I got 34 different ones we had there, which to be honest is quite good. And there was quite a few that came through really quickly that I didn't quite catch, particularly we've done quite a few. Receptionist, oh, whoever put that down, well done. Okay, and urologist and social, okay. So within the NHS, guys, so you came up there in a minute between you with call handler. Okay, you can stop now. Between you guys, you came up with, I'm going to give you a very generous 38 different career roles there. All right. There are, how many do you think job roles there are in total in the NHS? Different unique job roles. Okay, I feel like you guys have learned this before. It's actually, at the minute, 355 different job roles within the NHS. Okay, I'm not sure if Josh just heard that and typed in trying to look clever. Okay, but 355 unique job roles going on within the NHS, guys. And there's some really weird ones as well, which we'll talk about in a minute. So IT specialists, what can they do within the NHS? If you like working with IT and all that sort of information technology, what could you do? What would your role be? Admin? Not so much X-rays, data management, really good one. Okay. Actually, I'm going to take it as Rana's there. I'm going to go along with that and say data management is a massive one, because the NHS, as well as all diagnostic machinery, is actually a huge diagnostic exercise. Okay, and there's so much data being generated that has to be stored and sorted. So one of the things we have to do, and then years ago when I was in hospital, okay, the doctors used to go around with like clipboards at the end of the beds. They used to have to take notes and put them on there. Whereas now, if you go in, it's all done on iPads and stuff. So the whole data infrastructure at the minute has to be integrated and work seamlessly. Trouble is, not every trust systems work with other trust systems. So we've got an issue nationally where it doesn't work. And one of the things you'll notice, guys, particularly with the vaccine rollout at the minute, is that they're having issues with data management across different systems, which is why it's done on a brand new system nationally. Okay, so IT is massive in the NHS because the NHS is a slightly old-fashioned, because it's such a big organisation, it struggles to change and it needs to get up to speed with IT. So real people coming on board with IT skills are essential. Okay, what about mechanic? So we'll talk about mechanics who deal with vehicles. So more vehicles and equipment. So ambulance, yes. Fixing ambulances. What else do they fix? Aside from ambulances. The transport buses, yep. Anything else? No, they won't do the medical equipment. No, all vehicles. Right, okay, what about the first responder vehicles? So the cars you see going around, and Archie, spot on, helicopters, yes. They'll fix the air ambulances and motorbikes. They'll do the blood transfusion motorbikes as well. And believe it or not, bicycles. Because in some big cities, they actually go around on bicycles in their first responders because it's quicker. So they do a whole host of engineering works on lots of different vehicles, including the patient transport ones, some specialist ones, the what are they called, the emergency trauma ones as well. So mechanic, if you're interested in working with vehicles in the NHS, is really highly sought after because, let's be honest, no one wants to be in an ambulance and it breaking down on your way to hospital, does it? That's not a good look. Okay, so we do that. And then what about an engineer? So an engineer deals with machines within the NHS. So what could they be fixing? Medical machinery, yeah. Okay, so yeah, CT scanners, X-rays. Has anyone ever been in hospital? And just put a quick yes if you have. Right. Now, if you stayed in hospital, do you remember you had, if you were very lucky, you had to, well, lucky, unlucky, but you probably had the big machines that came around with all your entertainment on, like TV and all that sort of stuff that came in front of you and it's on a retractable thing, and your bed went up and down and all that sort of stuff. They sort that out as well. Okay, so as well as all the patient stuff, so the bed, the entertainment systems, they also deal with a large machine. So MRI scanners, you have X-ray machines, endoscopic equipment, heart monitors, they deal with all this sort of stuff. Also, they have to be quite inventive because a lot of machines, particularly like an MRI scanner, is absolutely massive. So what they have to do, guys, is they have to retrofit these into really old Victorian buildings. Okay, and somehow make them fit as well. So they have to be quite ingenious. I mean, our local trust, our hospital wasn't big enough, so they had to actually rent or buy some units on a retail estate for an MRI scanner because it just wasn't, it was too big. So also an engineer is not just based within the hospital buildings, the campus itself, but they work across the trust sites. So it could be in a retail park, an MRI scanner. It could be a GP surgery of X-rays, could be going to a dentist, okay? So engineers work everywhere else. Okay, I just want a simple yes or no, and I want you to be able to tell me if they can work in the NHS. So a tattoo artist, yes or no? Okay, the answer is yes. Okay, so a tattoo artist is used within the NHS to help people with scars, and they help design scars into sorts of tattoo patterns and stuff to help their self-image and all that sort of stuff. So yes, a tattoo artist is employed. What about a wig maker? You've got the idea now. Yeah, yeah. Okay, so wig makers, what do they make wigs for? Yeah, well done, Emily. Yeah, so people with cancer, okay, cancer treatment, they get wigs made for them from the NHS. So wig maker is actually a job role within the NHS. We had, you guys put down art therapists. Could you ride motorbikes for the NHS? Okay, and what would these motorbikes transport? Blood, what else? Organs, anything else aside from blood and organs? Okay, believe it or not, they do carry first responders as well, yes. Okay, now, COVID tests, they don't actually, because that's done by a separate company, a separate logistical operation. But also, the motorcyclists carry, believe it or not, breast milk, okay, for newborn babies and mothers. Some mothers who generate too much breast milk donate it to people who can't have it. So they also pick up breast milk as well for newborn babies and transport them to sites. So if you like riding motorbikes, you could work for the NHS. Absolutely bonkers. I mean, if you want to fly a helicopter, you can work for the NHS. It's absolutely bonkers, guys, the job roles we have. Okay, now, I reckon you guys might have seen this slide already because you seem clued up. But if we were talking about the top 10 world employers, so the biggest employers in the world, top 10, would the NHS be on that list, which is based just in Great Britain and Northern Ireland? Okay, if it was on a list, what number would it be? Number one, oh, four, two. Only one person so far, I think, has got the right answer. Okay, right, okay, guys, so the NHS is massive. These are the world's largest workforces as of 2015. This is the most recent data that you can find. Okay, so you've got the US Army there, Chinese Army. The NHS, which is based just in Great Britain and Northern Ireland, is the world's 5th largest employer. Okay, that's bonkers. Obviously, right underneath McDonald's, and let's be fair, McDonald's is pretty much global. Okay, I think the only place that doesn't have McDonald's is North Korea, isn't it? Okay, so it's pretty much global. Anyone know who Walmart are in the UK? Yes, Asda. Okay, that they own Asda in the UK, or did. I think I've just been taken over in here. Okay, so if you think about these organisations, they are global ones. Okay, whereas the UK health service is just very, very, very localised compared to these, and particularly like China's massive. If you look at the size of their petroleum corporations. The one at number 10, Hon Hai Precision Factory. Anyone know what they make? This is a factory that employs 1.2 million people. And it wasn't there 10 years ago. No, well, actually might make computer chips, but something you've probably all got. Yes, they make mobile phones, in particular Android phones. Okay, so they make Android phones, not iPhones, because they're from the dark side. Okay, no one likes Apple. Okay, they make Android phones, so they're massive as well. But the UK health service, based just in Great Britain and Northern Ireland, 1.7 million people employed directly, with currently 100,000 vacancies. Okay, so it's got potential to be 1.8 million people employed by the NHS in Great Britain and Northern Ireland. Okay, right, I've done boring stuff. Okay, we're going to focus in on the department very, very quickly now, because I'm looking at how long we've got left. We've got 25 minutes, but I'm assuming I need a break as well. Yeah.
Oh no, we're going straight through till 15:15 for this session.
Oh, blimey, guys. Okay, right. Okay, so radiology. What do they do? What's the radiology department do? Oh, okay, so Megan's put X-rays. What else? What else they do? MRI, radiotherapy, CT scans, ultrasounds, chemotherapy, treat. Okay, brilliant. Okay, now, so they diagnose and treat diseases using medical images, such as X-rays, everyone's favorite X-rays. Okay, they also use ultrasound scans. So when do you use an ultrasound scan? Babies, but any other time you'd use ultrasound? Aside from being pregnant. For the heart, to see the pelvis, the kidneys, excellent. Okay, so it's used kidney stones, well done. Okay, so they use it for a lot of different things. It's not just finding babies in a womb. Okay, guys. CT scans or computed tomography. Okay, and these are all quite specialist equipment now, very, very highly qualified to use. MRI scans. Okay, these are the big machines you'll see on TV where you actually go into the machine. It's a big circle and you go in the middle of it. And what happens is magnets spin around you at ridiculously quick speeds, and they take an image inside you. So it's a 3D image and they can see right through different depths and layers and stuff like that. Has anyone ever had an MRI scan here? Yeah. It's a weird experience, isn't it? Because it also feels weird as well, because I found it when I had it, it was like a warmth in my leg when it was being scanned. So it's an interesting experience, an MRI scan. It's very, very, very accurate. Okay. Sounds like a fun. Nuclear medicine. Now, sometimes we inject people radioactive dye to view like bloodstreams, different things going on in the body systems, okay, see what's happening. Okay, so nuclear medicine is what a radiology department does. So even though it says radiology, there's loads and loads and loads of different things. Okay. Why is it when you get an X-ray, the person doing it sprints away? It's got an iodine base. Okay, Emily, so an X-ray. Now, usually I found they do this a lot in a dentist as well. Okay, so what happens, guys, is an X-ray is not a dangerous level of radiation. Okay, it's not dangerous at all. It's barely more than background radiation. But if you're doing it all day, every day, your level of radiation exposure is going to increase. So just to reduce risk of anything radioactive or radiation problems is you just leave the room just to solve a problem. It is preventing an issue, which may not happen. Okay. But I'm worried if they're running out of the room. I think they need to have their timer on for a bit longer in your case. If they're running out, cool, blimey, with panic on their faces, go and get out. Right. Okay. So who works in a radiology department? What people work there? Engineers, good one. Yeah, radiologists, yes. Who else? Oncologists, potentially might be called in to consult. Radiographers, yeah, radiologists and radiographers, well done. Technicians, yeah. Nurses, good. Sonographers, they might be called in. Pathologists, hopefully not. A doctor may be called in to consult. Okay. So a radiology department, this is a typical radiology department. This is modelled on the one that we have in our healthcare trust here. Is you have a radiologist and a radiographer. So they are two different job roles. A sonographer, a nurse. Anyone know what HCA is? No, okay, healthcare, almost, yeah, healthcare assistant. So you'll get a healthcare assistant, you'll get a radiology department assistant, which is the RDA. You'll get your receptionists, okay, who work there because they're their own paternal department. You'll get your IT specialists working on it as well because they need to make sure all the equipment's working and all the information is talking to each other. Secretaries to all the people like the radiologists, radiographers, keeping records, and the appointment team. So where we are in Buckinghamshire Healthcare Trust, this is who makes up our one department. How many of these roles, looking at them, guys, do you think you could do straight from school? There's 10 roles there. So out of 10, how many do you reckon you could do straight from school? Okay. There's 7 roles there that you guys can do straight from school. Believe it or not. Everything from nurse onwards, so nurse, HCA, RDA, receptionist, IT specialist, secretaries and appointment team, you can do straight from school. For a nurse, you could enter as a nursing apprentice. Okay, so you could do a degree level, or you could do a nurse apprenticeship. So you could do that straight from school. Healthcare assistant, again, you can do straight from school. And RDA, so a radiology department assistant. Okay, that is almost the same role, just in a very specialist department. And all the other jobs are roles that they can take you straight on, guys. Usually after sixth form, yes. Okay, you could potentially do a HCA and RDA from the age of 16. But I usually mean from nurse apprenticeship, yes, it's probably going to be from sixth form. Okay, right. Now then, let's have a quick go at this. All right, guys, what are you going to do now? I hope you're not squeamish, because if you are, you might want to close your eyes. But I'm going to show you some real life x-rays from our trust. And I want you to try and tell me what's wrong by dropping in the chat bar. We're going to start off quite easy for you, okay? There we go. Oh, had to use the proper terminology there. I like it. Okay, guys, do you think it's the fingers or do you think it's your toes? Okay, yeah. So believe it or not, it is actually toes. So someone's broken their, I don't even know what they're called, those two little toes, but someone's broken 2 of their toes there by kicking. Believe it or not, they were frustrated. It's because they, believe it or not, it's elongated because of the angle of the camera as well. But this person got frustrated and they kicked the wall and they broke 2 of their toes, which is why we say at school, never kick stuff or hit stuff because you can damage yourself. But that's quite an easy one, isn't it? Yeah, 2 broken toes. Right. There we go. Just there in case you missed it. What about this one? Bonus points if you can name the 2 bones. Okay, Vanessa, well done. Catherine's going to send you a prize. I'm joking. We didn't agree that. Okay, yes. Broken radius and ulnar. So in your arm here, these two bones have been broken. Okay, this was caused by a contact injury. Basically, they were playing a sport, they went to protect themselves, bang, straight through, broke both the bones in their arms. They're in a cast for about 6 weeks on this one, waiting for it to get repaired. This cost more than, this one's slightly more complicated. If you look closely at it, you can see the outline of the arm, which is the kind of whitish hue around the bones, okay? And you can see how the arm is bending outwards, the skin is bending outwards where the bone's coming out. So it's a slightly more complicated fracture. So this costs more than £4.5 grand to fix. Okay, but yeah, you can see that one there is quite complicated, but it should hopefully slot it back in. But because of the bulge as well, it made it slightly more complicated. Right, and let me guess. Oh, a little picture there show where it is. Right, next one. What's wrong with this person? And I'll give you a little fact, guys. This is my X-ray. No, I've definitely not got a broken jaw. I do have a filling, yes. Tooth decay, all right. All right. Actually, I think I've only seen one person protruding jaw. Look at them right in front of you. You guys are picking on me a bit here. Okay. Right, I've seen one person sat. I'm going to try and scroll back up now. Is it Tiulu? I think was the only person who's come up with that then. Okay, or a couple of people getting now. Wisdom teeth, yes. Okay, now if you look at my lower jaw, okay, if you look at each end of my teeth, you can see two teeth which are pointing inwards, like that. And my wisdom teeth, what happened, guys, was they had to, well, they were growing into, it's quite a common thing, but they're growing into my jawline because there's never enough room for wisdom teeth. I don't know why they exist. Okay, which was causing a lot of issues, a lot of pain, and I had to be operated on to get them removed. Now, it's not pleasant when they do this, guys, because of actually there's 3 wisdom teeth they needed to remove here. So you've got 2 on the bottom jaw. Now, if you look at my top jaw, so on the left-hand side of your screen, the one on the end as well needed to come out because that was a wisdom tooth, shouldn't have been there. You look at the right-hand side of the screen, you see one that's up top hasn't quite come down from nasal cavity. So that one didn't come out for some reason, which is not a bad thing. All right. So how do you think they get them out, guys? What do they do? Yeah, surgery. Yeah, yeah. It was a proper full-on operation. So apparently this should happen to you in your 20s. I was 38, so I felt very flattered. But what happens, guys, is first of all, they knock you out with drugs, not a hammer. And believe it or not, they have to dislocate your jaw, okay, to really open your mouth up wide. And when I woke up from the operation, I had a big bruise on my chest. Why do you reckon that was? Any idea? Why would I wake up with a bruise on my chest? Yeah, Emily and a couple of Holly. Yeah, the surgeon had to lean on me and use my body as leverage to literally get the teeth out. Okay, guys, so they were leaning on me and then coming in and trying to get out at it like that with my dislocated jaw. Never a nice one, always funny, but it means you get to eat ice cream for a few days afterwards, which is quite nice. And it's not that bad, really. So yes, that's always good fun. So that was an easy one. Oh, look, here we go. Yeah, right. What about this one? None of them are me now, by the way, so you can say what you want. Tooth decay. It's not the patella. Yeah, dislocated elbow. Okay, now, would you reinsert this one yourself? Correct answer, Megan, Sana. Yeah, no. Okay, guys, you never, ever, ever relocate a broken jaw, a joint that's come out of socket. Okay, guys, never, ever do that because those are nerves and veins and stuff run through them. If you don't put it back in properly, you could fracture, you could burst a blood vessel or trap a nerve, which could lead to so many more problems. Always, always get it checked out, guys, okay? So yes, now, we're going to talk terminology now. So this is what they say. A complete dislocation with distal humerus, relative blah, blah, blah. That's what they mean, okay? They use very specific terminology, Some people do, Misbah. Yes, they do, but they shouldn't. Okay, and that, believe it or not, is Mel Gibson's fault. All right, and you think, why is it Mel Gibson's fault? In the 80s, he was in a film called Lethal Weapon, and Lethal Weapon 2, and his character kept dislocating their shoulder. And what he would do is to relocate his shoulder, he would whack it into a wall. And because it was the 80s and people were silly, they actually thought that was a way to do it. And so many people started copying that to relocate joints. It's the worst thing in the world to do. So it's actually all Mel Gibson's fault. Don't ever, ever relocate your shoulder by whacking into a wall doing that. Okay, guys, get yourself proper treatment. Because if it keeps copying out, they need to actually do work on it as well. But yeah, that's Mel Gibson's fault, believe it or not. Okay, next one. Oh, this is harder, this one. You can tell this one's slightly more serious because it's got an alert on it. Not dislocated shoulder, nothing to do with the collarbone. Nope. Clavicle's okay. Nerves trapped. No, you wouldn't see a nerve on an X-ray. A tendon, something. No. No. And because tendons and ligaments are organic, they don't show up in X-rays. Is that a string? Where? Oh, I see what you're saying. No, no, it's not. No. Okay. Let me see if this helps. What about that? Okay. Okay, and these are real X-rays as well, guys. So what we've got here, and this is what they're saying, a pathological fracture of the left proximal humerus, typical of a simple bone cyst. Yeah, blah, blah, blah. Okay. What they're saying there, guys, is that there's a bit of injury. There's a cyst here or bone disease. They're not sure what's causing it. A small piece of bone is broken off, but they're worried that yeah, it could be a tumor. Okay, it could be some form of cancer. It could be a cyst. They don't know, which is why it's an alert, why it needs to be investigated. It can be common. It depends on people's diets as well, and if they don't have enough calcium. But it needed further investigation. No, bones aren't inorganic. They have inside their living organisms. You get your red blood cells from your bones inside the bone marrow. Okay, so it's like a cyst bursa. So it's just something going on. Okay, guys, it did involve. I don't actually know what the outcome of this one was, but it was highlighted and there was an alert on that one. Right. Oh, okay. This is the last one, I think. See what we got. This isn't me. Yeah. Okay, guys, we're getting that one quite nicely. So, yeah, I think we all figured it's a jaw, haven't we? Yeah. So now, if you look at where it says PA alert, just to the left-hand side of that, you can see a break, can't you? Okay, it's quite clear, dark area there, and that is a break. What you can't quite see, if you go diagonally down to your left, just to the end of the tooth line, as it were, in the bottom jaw, okay, I think the PA stood for the initials of the person they were alerting. Right, if you go down the jaw, you can see actually where it's slightly darker there is another break. So this was a Friday night injury, and they came in at midnight. Guess what? They've been drinking, and they've been punched very hard in the face by someone who was right-handed. So it hit them on the left-hand side of the face there, bang, broke the jaw there. But because the jaw's attached both sides, in sympathy, it broke that side as well. Okay, so it broke their jaw in two places. No, it's pretty more than a hairline fracture. This is quite a big one. So what did this guy had to have his jaw wired, okay, until they could repair it, and was literally using a straw for a couple of months until their jaw fixed. Okay, so it's quite an interesting one how just being punched in the face broke the jaw both sides. So literally the bottom of it was hanging, and they couldn't control their jaw muscles. Okay, guys, about I think it's at least 6 weeks, which is a standard one. Now let me go here. Yeah, significantly displaced fracture through the angle of it. Yeah, Contracoup is what they call a sympathetic break. Contracoup, silly word. And that's what it's saying there. Okay, basically broken their jaw in 2 places. The reason they use such specific terminology, guys, to make sure we're getting the right things and dealing with the right areas. Okay, does that make sense? We happy with that? So this is all the joys of radiology department here, okay, particularly in the x-rays. Now, how would you work in a radiology department? How would we get there? I'm just going to turn the chat off very quick. In fact, no, I'm going to move it out of my way so I can see, sorry. What we've got here, guys, is our trust's career plan pathway as it is, and how it works in our radiology department, okay? In that you have on the left-hand side of your screen all the degree level roles and the higher paid roles, and on the right-hand side of the screen all the lower paid roles, all the entry level roles, okay? So looking at it from the right-hand side, GCSE in Maths and English, and you could be a reception appointment, deal with reception, deal with appointments, do the admin, be an IT specialist. It's on-the-job training, okay, and it's immediate start. So this is something you can do straight from school, ideally after 6th form, but you can do it with GCSEs as well, okay? And your salary range starts from £16,500 to £27,000, which is not that bad, really. With the NHS, the more qualified you get, the higher your pay gets, guys, to be honest, okay? So it works its way up. So as a 16-year-old earning 16 grand, it's not bad. Okay, but as you get more qualified, you'll get more money. Healthcare assistant or radiology department assistant, it's the same thing basically. Again, GCSE Maths and English. All your training is on the job. Okay, so we recently did some through our college where we trained some healthcare assistants, and it was done on the job. Start immediately. You start off on just under £20,000 a year, going up to £24,000 a year. Okay, and again, the more experience you get, the better. Now, the beauty is with a healthcare assistant, once you've done that for a few years, you can then train to be a nurse. Okay, so you can transfer across. So then a nurse, you need to get an A-level BTEC equivalent. Okay, BTEC national equivalent. Nurses are now degree levels, but you can do it as an apprenticeship. You can do an evening course, or you can do a degree at university. So you can go straight in a degree at university and go straight in that way. Spend 3 years at uni, then go in. Or you could be a healthcare assistant, do night school to get your degree or open university qualification, or you could do it as an apprenticeship, which are really, really popular at the minute. It takes 3 to 4 years to qualify as a nurse, and your starting salary is just under £25,000 a year, going to the higher qualified ones of just under £38,000 a year. Okay, then the last 3 are more specialist qualifications where you do need degrees, but because of that, your pay is also higher. So a sonographer, okay, needs a specialist degree, okay, or you can do an apprenticeship, but to specialise in ultrasound takes 5 to 6 years to train, and you can get up to 43 grand a year doing that. Whereas a radiographer, so deals with not just x-rays, but other radiological stuff as well. Again, it is a degree, but your starting salary starts at 25, and you can finish at just about £44,500 a year. Okay, until we come to like the head honcho department, so a radiologist, 13 years to train to be fully qualified to be a radiologist, guys. Okay, takes a long time, it's very specialist, but your starting salary is just under 40 grand a year. Your final salary could go up to £105,000. Okay, guys, that's more than that's a lot of money. Okay, that's an awful lot of money for someone who's very, very well qualified. And the good thing is, guys, you can start off if you wanted as a healthcare assistant, and you could move along every time to a healthcare assistant to a nurse. Then you could either become a nurse, you could become a sonographer if that interested you, or you could train to be a radiographer, or you could train to be a radiologist. So even if you don't go straight in at degree level, you can train your way across each bit, guys, to make sure that you're qualified and get the job role you want. I am very aware of time here. Sorry, as a consultant radiologist, the highest it is in this department. Yes, we're focused on this department. 13 years total, include medical school and a foundation program. In fact, take a year off the foundation program. Right. I think it's my time's up, isn't it? Catherine?
Yeah, well, no, we do have lunch, so the students now have a full hour's break, but just a
Oh.
couple of questions have come in, so
Go on.
we will go to them. But that was really insightful, Adam. Thank you very much.
That's all right. No worries.
I don't know if you can answer this one. If you train to be a midwife, will you be trained to carry out an ultrasound?
Yes. Simple question, simple answer.
And does 13 years radiologist training include GCSE?
Unfortunately not.
And can you go from a nurse to a doctor? And if so,
Yes.
how many years?
Yes, you can. So it takes about 6 years to be a doctor, but it depends on how you'd want to do it. So being a doctor is a degree. So you'd have to, so the time it takes depends. It takes 6 years on average to be a doctor. So if you're a nurse, you would have to either take 6 years out, do a degree for 6 years and then go back, or do it like in night school, evening classes, or some sort of, your employer might let you train on a job, so give you a day release to do stuff as well. So unless you do it as a degree, it will take slightly longer, but you can make that jump. So any role in NHS, you can move across with and move on to different things.
Great. So hopefully that has reassured some of you students. But yeah, thanks again for your time,
No
Adam.
worries.
Really insightful, and well done, students, for getting involved. A really fun interactive session. So you've now got an hour's lunch break. So I've put the next Zoom link into the chat box, but I will be on the line for another 5 minutes or so. So guys, if you do have any questions, please do let me know. But thanks very much,
Right.
Adam.
And I'm just going to answer Emily's question on the chat bar, if that's okay.
No, that's no problem.
Cool.